Hi, class. It's Dr. Lindner. I just wanted to go over a topic that comes up quite a bit and can be a little bit confusing for students to kind of separate in their brains, and that is the difference between sprains and strains. They sound a lot alike, they look alike, but you could see they're a little different, right? Sprain with a P, strain with a T. Are they the same thing or are they different? So let's take a look. They are very, very different. And sprains, if you look on the left-hand side, we're looking at the foot and the ankle here. This is the tibia, and the lateral bone is the fibula, right? This is medial, this is lateral, this is the great toe, the hallux. Here's the fifth toe, and here's the fifth metatarsal, and that's the first metatarsal. And these are the tarsal bones. So between the talus, I'm sorry, the tibia and the talus, and between the fibula and the talus, right? Between bones, we have soft tissue structures that hold them in alignment to one another. And those are called ligaments. Ligaments go from bone to bone. On the right hand side, we have tendons, and these are muscles, muscles attached to bones by way of tendons. So that's an easy way to remember the difference between sprains and strains is strains has a T, tendons have a T, and we know that tendons are the attachment of muscles to bones, right? Muscles are the contractile tissue. Muscles contract, they transmit their contractile force to tendons, and the tendons attach to the bones. And most muscles have at least two tendons, right? There's a proximal attachment and a distal attachment. And usually it's the distal attachment that moves, whereas the proximal attachment stays stationary. So a sprain and a strain are both damaging or stretching anatomical tissues beyond their limit. Sprains are when you stretch ligaments beyond their anatomical limits, and strains is when you stretch muscles and tendons beyond their anatomical limits. When something gets stretched beyond their normal anatomical limit, they overstretch, fibers can tear, they rip off bone, they separate at different parts, sometimes in the middle, sometimes at the attachment. So in this particular picture, on the left-hand side, this is a sprain where the soft tissue structures of ligaments are stretched beyond their anatomical limit, and there's a lesion, there's a tear. This is what happens when your ankle, when you slip down stairs, or your ankle falls in a pothole, or you slip down off a curb. It typically happens with a plantar flexion inversion type of injury at the ankle. So when the foot plantar flexes and inverts, which means it's kind of like rolling inward, everything on this outside part overstretches, and these can tear. And this is probably the most common tear or sprain. It's to the anterior talofibular ligament. There's a posterior talofibular ligament and a calcaneofibular ligament, but the anterior talofibular is the one that most commonly gets sprained or even tears during a plantar flexion inversion injury of the ankle. And the reason why plantar flexion inversion injuries are quite common is if you look at the anatomical structure and the osseous support at the ankle, when you look at the tibia right here, that's the medial malleolus. And when you look at the fibula right here is the lateral malleolus. And the lateral malleolus descends further distally than does the medial malleolus. So here's the medial. If we draw a straight line across, we could see that the lateral malleolus descends further distally, and this osseous articulation prevents the foot from everting, but because this is higher up, the foot can invert, and that's how these get damaged. When you have the damage to the outside ligaments, soft tissue structures on the muscular side can also be damaged. So you can have a strained sprain, right? It's just understanding that strains is when the muscles and tendons get damaged. Sprains are when the ligaments get damaged. So then when there is a ligamentous damage on the outside of the ankle, you would say anatomically, what do we have on the outside of the ankle, muscle and tendon wise? And we have the peroneus sisters there. We have peroneus tertius, we have peroneus brevis, and there's another one, it doesn't quite show it, but there's another peroneus longus that goes like this and goes underneath. I'll make a dotted line like that and attaches here to the inside. So that too can be strained. Peroneus longus, peroneus brevis, and peroneus tertius. Now, so we understand the concept of strain and sprain now. Which one takes a longer time to heal? Which one heals quicker? Muscles and tendons have a better blood supply, and as a result of a better blood supply, muscles and tendons can heal quicker. Ligaments take a longer time to heal. Now, we have muscles and tendons around and ligaments around other parts. So another common area where we can see soft tissue injuries is around the cervical spine. Now you can see there's lots of muscular support around the neck, not just on the muscular side, but look at all the ligaments, right? It has a very important job. The spinal column has to protect your spinal cord. So look at all these little intrinsic ligaments that we have. I mean, there's your disc, the intervertebral disc, and even in front of the vertebral column, there's the anterior longitudinal ligament. And just behind the vertebral body, there's the posterior longitudinal ligament. So sometimes we get disc herniations when these bulge, when this thing starts to push backward before it hits the spinal cord, it can distort the PLL, the posterior longitudinal ligament, stretching that out. And when you stretch ligaments, that's a sprain. And those ligaments are very, very pain sensitive. Look at these in between the transverse processes, the intertransverse ligament. And right back here, we see there's a spinous process. There's even ligaments that go from spinous process to spinous process. So all these structures can be injured and damaged, especially in a what used to be called whiplash. Now they call it in a cervical, sometimes they call it a CAD, a cervical acceleration deceleration injury, which at one point used to be, just call it a whiplash injury. So if someone hits you from the back, the head hyperextends and then flexes, right? It goes back and forth. And when it goes backward into hyperextension, everything in the front can get overstretched, muscles and tendons and ligaments. This one here is just showing the intervertebral discs, and it's showing the anterior longitudinal ligaments in the front of the vertebral bodies. But on the back, we also have lots of ligaments along the back. Okay, so hyperextension can overstretch the structures in the front, and then when it hyperflexes, you can overstretch structures in the back, ligaments and muscles and tendons, so you can get a cervical strain sprain type of injury. And same concept, the muscles can heal a little bit quicker, the ligaments take a little bit longer. Okay, we hope you found that interesting.